Hi friends, welcome back to my channel Nursing Guru 24. Today we will solve MCQs from Norcet-7 question paper with explanations. This video is going to be long. Please watch till the end. If you like this video, please do subscribe, share and like video. Hit the bell icon so that you never miss the updates. Let's start with first question. The first question is, causative agent of Lyme disease is. Options are Rickettsia prowazekii, alphavirus, Borrelia burgard feri, Trypanosoma brucei gambinis. Here the correct answer is the option number 3, that is Borrelia burgard feri. Rickettsia prowazekii is a bacteria that causes typhus, that is transmitted by lice. Then alphavirus is a type of virus that causes some disease like chikungunya. They are transmitted by mosquitoes. Then Borrelia burgard feri is a spirochete bacteria that causes Lyme disease, that is transmitted by ticks. And Trypanosoma brucei gambinis, it is an protozoan parasite that causes African sleeping sickness, that is transmitted by tsetse flies. Here the correct answer is option 3, that is Borrelia burgard feri. Which among the following is the sign of severe dehydration among infants? Options are anxiety and increased skin turgor, drowsiness, depressed fontanelle and decreased skin turgor, excessive crying and excessive thirst. Fourth option is drowsiness, bulging fontanelle and decreased skin turgor. The correct answer for this question is option number 2, that is drowsiness, depressed fontanelle and decreased skin turgor. Anxiety and increased skin turgor. Anxiety may be occurring dehydration, but increased skin turgor is not a feature. Skin turgor decreases with dehydration. Then drowsiness, depressed fontanelle and decreased skin turgor. These are the very important signs of severe dehydration in infants, indicating fluid loss and poor tissue hydration. Then the third option, excessive crying and excessive thirst. These are the signs of mild to moderate dehydration, not severe dehydration. Then last one, drowsiness, bulging fontanelle and decreased skin turgor. Bulging fontanelle usually suggests that there is increased intracranial pressure, not dehydration. What are fontanelle? Fontanelle are the wide gaps between suture lines. There are mainly two fontanelle, that is anterior fontanelle and posterior fontanelle. Anterior fontanelle is the larger one, posterior fontanelle is smaller one comparing to anterior fontanelle. And anterior fontanelle is diamond shaped, posterior fontanelle is triangular shaped. Anterior fontanelle takes 1.5 years to close and posterior fontanelle takes 1.5 months to close. Here the bulged fontanelle is the sign of increased intracranial pressure. The answer for this question is drowsiness, depressed fontanelle and decreased skin turgor. In case of dehydration, there will be depressed fontanelle. Next question is, which options describes orthopnea? Which options describes orthopnea? Options are ability to breathe only in upright sitting or standing position, slow breathing, difficulty in breathing, rhythmic waxing and waning of respiration. Which options describes orthopnea? Here the correct answer is option number 1, that is ability to breathe only in an upright sitting or standing position. Ability to breathe only in an upright sitting or standing position is the characteristic of orthopnea. This is usually associated with heart failure or lung conditions. Then slow breathing is known as bradypnea. It is often due to neurological issues or due to some medications or due to some metabolic disorders. Then difficulty in breathing is called as the dyspnea. It is commonly used for uncomfortable breathing. Then rhythmic waxing and waning of respiration describes Chinese Stokes respiration. It is a type of breathing pattern seen in heart failure or in some brain injuries. Hence, the correct answer is ability to breathe only in an upright sitting or standing position. Next question is, the obstetrical assessment of the following reveals. The obstetrical assessment of the following reveals. Here they have given a scenario with some features. That scenario includes some key points or some features. They are, first feature is, this is her third pregnancy. Second is, her first child was delivered at 38 weeks. And third feature is, her second child was delivered at 34 weeks. Here they told to calculate the GTPAL score. They told to calculate the GTPAL score. What is GTPAL score? G stands for gravida, T stands for term births, P stands for preterm births, A stands for abortions, and L stands for living children. What is gravida? Gravida refers to total number of pregnancies including the current pregnancy. Total number of pregnancies or previous pregnancies including the current pregnancy. Then term birth means deliveries at 37 weeks of gestation or more than that, before 42 weeks of gestation. Then preterm babies, deliveries between the 20 to 37 weeks of gestation. And abortions, pregnancy losses before 20 weeks. Here, according to this scenario, this is her third pregnancy, means G, that is gravida is 3, because one was preterm, one was term baby, and now she is pregnant. That means gravida is 3 term births. One baby means her first child was delivered at 38 weeks. Hence this is term baby. That is T is 1. Then P is her second child was delivered at 34 weeks. That means that child was premature. That child was preterm. Hence P is 1. Then there were no abortions. Hence A is 0. And those two children, preterm and term babies, are living. Hence L is 2. From this, it is clear that the GTPAL score for this scenario is 31102. 3 is gravida 3, T1, P1, no abortions, hence A is 0 and L is 2, 2 living children. Next question. A patient arrived at an emergency department after a RTA, road traffic accident. His pulse rate is 127 bpm, that is beats per minute. Blood pressure is 90 by 56 mm of Hg with cold extremities. The nursing officer understands that the patient is at risk of which type of shock? Options are neurogenic shock, hypovolemic shock, spinal shock, cardiogenic shock. Here the correct answer is option number 1, option number 2, that is hypovolemic shock. What is hypovolemic shock? Hypovolemic shock is usually caused by significant fluid or blood loss, like in trauma or hemorrhage. When there is more blood loss or fluid loss, there will be hypovolemic shock that leads to tachycardia. Here 127 bpm is the tachycardia, and hypotension they have given 90 by 56, and cold extremities due to reduced perfusion. Then neurogenic shock. This is usually caused by disruption of the sympathetic nervous system. Usually this type of shock is associated with bradycardia, warm skin, and hypotension. Then spinal shock. It is a temporary loss of reflexes below the level of a spinal injury, not primarily associated with hypotension or tachycardia. Then cardiogenic shock usually occurs due to heart failure, presenting with hypotension and poor cardiac output, but less commonly cold extremities. Here the correct answer is hypovolemic shock. Hypovolemic shock causes tachycardia, hypotension, and cold extremities. In this scenario, hypovolemic shock is the indicator for this answer. Hypovolemic shock is due to blood loss in a road traffic accident. The correct answer is hypovolemic shock. When examining a patient who is paralyzed below the T4 level, the medical surgical nursing officer expects to find. When examining a patient who is paralyzed below the T4 level, that is thoracic vertebrae 4 level, the medical surgical nursing officer expects to find. Options are impaired diaphragmatic function requiring ventilator support, flaccidity of the upper extremities, independent use of the upper extremities and efficient cough, then hyperreflexia and spasticity of the upper extremities. Here the correct answer is option number 3, that is independent use of the upper extremities and efficient cough. Here is why. Paralysis below the T4 level means the spinal cord injury occurs below the 4th thoracic vertebra. This results in paraplegia, means paralysis of the lower limbs, that is legs. The spinal nerves controlling the diaphragm and upper extremities originate above the T4 level. Therefore, individuals with T4 level paralysis usually retain or keep normal function of their upper limbs and diaphragmatic breathing. Hence, the nursing officer should find normal functioning of the upper limbs and normal diaphragmatic breathing. That indicates there is no injury above T4 level. Paralysis below T4 level affects lower limbs, not upper limbs. Then why other options are incorrect? I told first option impaired diaphragmatic function. It usually occurs in injuries above C4, that is cervical vertebrae 4, as the phrenic nerve which controls the diaphragm originates in the cervical spine. As I told earlier, that diaphragm is supplied by nerves originating above the T4 level, so its function is not affected. Then flaccidity of the upper extremities. This may occur with injuries at or above the C5 to T1 level, that is cervical vertebrae 5th to thoracic vertebrae 1, affecting the brachial plexus. The upper extremities are usually not affected by T4 level paralysis. Then hyperreflexia and spasticity of the upper extremities. Hyperreflexia and spasticity are more commonly associated with upper motor neuron injuries, which typically occur higher up in the spinal cord, not at T4 level. Hence, the correct answer is independent use of the upper extremities and efficient cough. Next question is contraindication of liver biopsy is. Options are diabetic condition of the patient, decreased activated partial thromboplastin clotting time, that is APTT. Third option is increased activated partial thromboplastin clotting time. Last option is immunocompromised patient. Here the correct answer is increased activated partial thromboplastin time, that is increased APTT. I told first option, that is a diabetic condition of the patient. Diabetes is not a contraindication for liver biopsy unless there are uncontrolled blood sugar levels, glucose levels, or any related complications like severe infection or poor wound healing. Second option I told decreased activated partial thromboplastin time, that is decreased APTT. Decreased APTT indicates a faster than normal clotting time and does not contraindicate liver biopsy. Increased APTT indicates a clotting disorder. It increases the risk of bleeding during or after the liver biopsy. Hence, this is the major contraindication of liver biopsy. Then immunocompromised patient. Immunocompromised state increase the risk of infection. It is not an absolute contraindication. Adequate precautions can be taken to prevent the infection. Hence, increased APTT is the major contraindication for liver biopsy. Next question is normal blood pressure of the adults. Yes, this is the very basic question. normal blood pressure of the adults? Options are 120 by 160 mm of Hg, 120 by 80 mm of Hg, 100 by 70 mm of Hg, 140 by 90 mm of Hg. Here the correct answer is option number 2, that is 120 by 80 mm of Hg. If it is more than 130 by 90 mm of Hg consistently, or if it is below 100 by 70 mm of Hg consistently, that is called as. Comment me the answer in comment box. Next question is, the most preferred site of administration of intramuscular injection in children under 1 year is dorsogluteal site, vastus lateralis, ventrogluteal site, deltoid site. Here the correct answer for this question is vastus lateralis. Dorsogluteal site is not preferred in infants due to the risk of damaging the sciatic nerve and insufficient muscle development. Vastus lateralis, it is the most commonly used site in infants. This muscle is found in lateral thigh. It is the safest and most reliable site in infants for intramuscular injections. This is the most preferred site because it is well developed and easily accessible in children or in infants. It reduces the risk of complications. Hence, this is the choice of site for intramuscular injection. Then, ventrogluteal site, it is an alternative site for older children and adults, but less commonly used in infants due to their small muscle in the area. Then, deltoid site is not recommended in children under 1 year because the muscle is underdeveloped and those muscles cannot accommodate larger injection volumes. Hence, vastus lateralis muscles are commonly used for IM injection site. Next question is, when serum bilirubin level rises on third and fourth day after birth of the baby due to inefficient hepatic function is known as pathological jaundice, obstructed jaundice, physiological jaundice, viral hepatitis. Here the correct answer is physiological jaundice. Physiological jaundice is a common condition in newborns. It is caused by the temporary immaturity of the newborn's liver, which is responsible for processing and eliminating bilirubin. For in-detail description regarding neonatal jaundice, I made a separate video. Please watch that. The link is also given in description box. Bilirubin levels typically rise on third and fourth day of life and then gradually decrease over the next week or two as the liver matures. Then other options, I told pathological jaundice, it appears within the first 24 hours of life and is associated with some serious medical conditions. Then obstructed jaundice, this occurs when there is a blockage in the bile ducts preventing the flow of bile from liver to the intestines. Then viral hepatitis, as the name suggests, this is the infection of the liver caused by viruses. It is not a cause of jaundice in newborns. Hence, the correct answer is physiological jaundice.